So we are live now. So with all your due permission, shall we start?
Yes, start.
Thank you so much, sir. Good afternoon, everyone. This is Batul from IJCP, the moderator for today's session, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned stalwart who is present here with us today. Well, sir needs no introduction, but yet it's our great pleasure and honor to introduce him. He is none other than the very renowned pediatric Professor Dr. Bharat J. Parmar, sir. Sir is MBBS, MD, DHA, FAIMS, Professor and Head of Pediatric Department at Zydus Medical College Hospital, Dahod, Gujarat. With Sir's wonderful insights, we are going to talk about the topic for today, which is recent updates in the management of measles, World Immunization Week. And before moving on to the topic for today, let us have a brief look on what the topic says about. So, the management of measles have seen recent updates focusing on high vaccination coverage rates to achieve herd immunity and prevent outbreaks. Early detection and isolation of cases are crucial for containing the disease's spread. Treatment primarily involves supportive care to manage symptoms such as hydration and fever control. Monitoring for and addressing complication is also essential for effective patient care. So, in this World Immunization Week, we are going to learn more about the topic. So, now without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. Sir, over to you.
Good evening to all. First of all, I am very thankful to CleanNet giving opportunity to highlight my views regarding recent update in the management of measles in this World Immunization Week. Measles, rubella is a commonest vaccine preventable illness characterized by fever, upper respiratory tract infection, and generalized maculopapular rash with self-limiting course, but morbidity and mortality is high. The widespread immunization has reduced the disease burden, but sporadic case or a limited outbreaks are common. Measles is an extremely contagious viral disease with a high burden of childhood morbidity and mortality in developing countries. Till 2017, a monovalent live attenuated measles vaccine was used in national immunization program at the age of 9 months, followed by second dose at 15 months. In two-dose schedule, this monovalent vaccine helped to prevent this highly contagious disease and its serious complication. The government of India launched a campaign of administering a single dose of measles rubella MR vaccine between the age of 9 months and 15 years with the goal to reduce the number of cases occurring annually. The entire course of uncomplicated measles lasts about 7 to 10 days. The serious and fatal complications include pneumonia, diarrhea, and encephalitis. Infection confer lifelong immunity. What is the epidemiology of the measles? The measles virus is an RNA virus of only one known serotype present in nasopharyngeal secretion of infected clinical and subclinical human case. Infection is transmitted by droplet infection. Disease is highly contagious with secondary attack rate of as high as 80% and period of infectivity extends from 4 days before to 5 days after the appearance of rash. High risk factor for measles. The maximum cases are seen in preschool children. Maternal antibody in endemic region protect the infant till 4 to 6 months. Immunization and natural infection usually provide lifelong immunity in measles. Overcrowding and poor immunization coverage are a two important predisposing factor for measles outbreak in a community are more common in winter and spring season. What is the pathogenesis of measles? The sequences of events in pathogenesis of measles are: first, there is a local viral multiplication. At a site of entry, there is a nasopharynx for a short period, and transient asymptomatic primary viremia, spreading virus to the distant site, especially lymphoid tissue, and active multiplication in the lymphoid tissue for 1 week, and symptomatic secondary viremia with the development of clinical disease. Essential pathological lesion in measles is generalized inflammatory reaction with perivascular infiltration, especially in the skin there is a rash, and the mucous membrane there is a complex spot, and the lymphoid hyperplasia, especially in appendix with the multinucleated giant cells, there is a Bartin Frankelday cells. Other important changes include interstitial or H giant cell pneumonia and perivascular demyelination, that is encephalomyelitis. Clinical manifestations of measles. Although subclinical infection are common and typical case presents after incubation period 10 to 12 days with the 3 stage. First stage, that's the prodromal stage. It remains for 4 to 5 days with a mild to moderate fever, upper respiratory illness with cough, coryza, and conjunctivitis. Conjunctivitis is characterized by transverse line of inflammation across the bulbar conjunctiva and sharply demarcated the lid margin. The complex spots are a pathognomic lesion in this prodromal phase, seen as a grayish-white sandy spot dots surrounded by slightly reddish areola, usually opposite the lower molar on an oral mucosa. These spots are present from 2 to 3 days before to 24 hours after the appearance of rash and herald the onset of skin rash. Second stage, there is an eruptive stage. It remains for 5 to 7 days. The skin rash appear on a 4th to 5th day with a transient rise of fever and starting as a faint blanching macule and first along the hairline behind the ears, face and the neck. These are descending rash, and these rash rapidly turn maculopapular and extend downwards, involving whole body in the next 2 to 3 days. Rashes may be associated with moderate cervical lymphadenopathy, constitutional symptoms, anorexia, malaise, GIT, gastrointestinal upset, diarrhea, vomiting, abdominal pain due to mesenteric lymphadenopathy. And in third convalescent phase, the rash disappear in a same sequence after 5 to 7 days, leaving behind browny brown desquamation. There is a post-measles staining for next 10 to 15 days. A typical presentation of measles include there is a hemorrhagic black measles, is a life-threatening illness in immunocompromised children characterized by high fever, confluent rash, altered sensorium, and the bleeding diastasis, and modified measles with a transient, few and faint macular rash with a minimal fever and constitutional symptoms seen in immunized case, young infant less than 9 months due to maternal antibody, and children who have received immunoglobulin globulin prophylaxis in incubation period. Complication of measles. In measles, there is the early complication and the late complication. The early complication, there is upper respiratory infection, there is the otitis media, laryngitis, tracheobronchitis. Lower respiratory infection, there is a pneumonia. Gastrointestinal, there is a enteritis, diarrhea, and appendicitis. And CNS complication, there is a measles encephalitis, retrobulbar neuritis, and Guillain-Barré syndrome. And pertaining to cardiovascular system, complication of measles is myocarditis. And hematological complication, that is purpura and DIC, there is a disseminated intravascular coagulation. Late complication of measles. Late complication measles, there's a protein energy malnutrition, transient immunodeficiency till 3 months after measles, and reactivation of tuberculous focus and bronchiectasis. And very late complication of measles, there is SSPE, there is a subacute sclerosing panencephalitis. પૂરી નહીં લીધી સ્લાઇડ યાર પૂરું નહીં આવ્યું એના રિમાર્ક્સ ને બધું છે ને ના ના 20-21 સ્લાઇડો છે આ તો 13 જ છે ફર્સ્ટ લિસ્ટો પર આ સ્લાઇડ ના ના આ છે ને યાર છે ખૂણામાં એમ તો છે યાર હું જોઈ છે ને 22 સુધી છે શેર કરો
શેરિંગ છે હા શેરિંગ આ સ્ટોપ કર દો કે નહીં
ના ના શેર કરવાનું છે
હા શેર કરવાનું પણ આ મેસેજ આવ્યો
હા ના ના એટલે પછી પછી જોજો યાર મૂકો ને રાડ તમે યાર શેર કરો બરાબર
22
કેમ થતું નહીં
થઈ ગયું
બદલાય છે ક્યાં Diagnosis of measles. Diagnosis of measles is mainly clinical based on a history of ongoing outbreak or unimmunized child. Second is a typical rash after 4 to 5 days of prodromal illness and the presence of Koplik spot for early diagnosis and the post-measles staging for retrospective diagnosis. The laboratory confirmation is rarely required and include serological testing within with more than four-fold rise in immunoglobulin antibody after 15 days, and the viral culture on a human embryonic or rhesus monkey kidney cell, and supportive evidence of measles. There is a leukopenia with relative lymphocytosis and the presence of multinuclear giant cell or an intracellular inclusion body in infected tissue after 5 to 10 days. Differential diagnosis of measles, there it includes other cause of maculopapular rash, especially other exanthemas, fever, there is a dengue, allergic rash or a drug rash, and malaria. These are the differential diagnoses of measles. Treatment of measles. The treatment is mainly symptomatic with a specific antiviral therapy and include maintenance of nutrition and hygiene, antipyretic and humidification to relieve cough, and the treatment of complication of measles. And the single dose of vitamin A supplementation, there is a 1 lakh international unit in the infant and the 2 lakh international units of vitamin A in older children is known to reduce mortality and morbidity in measles. How to prevent measles? The prevention and outbreak control measure in measles include universal immunization with live attenuated vaccine at the age of 9 months, followed by second dose of measles, mumps and rubella MMR at 15 to 18 months. And the post-exposure prophylaxis is useful to reduce severity and the duration of the disease only received within 3 to 5 days of exposure, and it is indicated only high-risk household contact as follows. Unimmunized infant, there is an immunoglobulin with vaccine, and older immunized children without past history of disease, only vaccine. Immunocompromised or a pregnant mother, only immunoglobulin, there is a 0.25 ml per kg of immunoglobulin, and the isolation of the case and the susceptible contact during infectivity period, there is a 7 days after exposure to 5 days after appearance of rash. So, concluding remark of this today's CME of recent management of measles, there's a measles is highly contagious acute viral illness lasting for 7 to 10 days that confer lifelong immunity against further episodes. It is leading cause of death among all vaccine preventable disease. The measles virus spread by respiratory route or conjunctiva. The period of infectivity usually 4 days before and 5 days after the onset of rash. Measles is characterized by generalized maculopapular rash lasting 3 days and temperature is more than 38.3 degrees centigrade. There is 101 Fahrenheit and presence of cough, coryza and conjunctivitis and Koplik spot is present are a pathognomic for measles. So triad of measles is fever, maculopapular rash and conjunctivitis. The common complications of measles include pneumonia, diarrhea, and encephalitis. Uncomplicated measles generally resolve on its own within 7 to 10 days. And the treatment is mainly symptomatic, and vitamin A should be given to all children diagnosed with measles. And WHO and UNICEF recommend administration of 2 doses of measles containing vaccine to ensure adequate protection against disease. Thank you.
Thank you so much, sir. Thank you for your enriching talk and for sharing such wonderful insights upon the topic with us. Thank you so much for that. We have received few questions from the participants. So with all your due permission, I would like to put across those questions to you.
Yes, yes.
The first question is related to the emerging trends. So, what are the emerging trends in measles epidemiology globally, and how do they impact management strategies?
What the emerging? There is a nowadays there is a emerging this uh, infection in children are two. One is measles and second is whooping cough. So the measles is it is a viral infection and very contagious infection. So and its morbidity and mortality of measles very high. So recommendation of measles vaccine, there are two doses. One dose at 9 months and second dose of this MR at 15 years of age, and the prevents the disease severity and complication of the measles.
Thank you so much, sir. Thank you for answering that question. We will move to the next question, and the next question is related to the challenges. What are the challenges in achieving measles elimination goals, and what strategies are being implemented to address these challenges?
So measles, this viral infection, it is serious one, also contagious one, and its mortality and morbidity is high. And the most common life-threatening complication, it is measles encephalitis, and the long-term nutritional complication, there is a protein energy malnutrition. And also, two most common complication, there is diarrhea and pneumonia. So there is a the measles and the complication diarrhea, the management of the case with the IV fluids and vitamin A. In pneumonia, there is a oxygenations and antibiotic and vitamin A. Sometimes there is the local complication, there is a due to this otitis media, and it leads to chronic otitis media, and later on there is deafness. So the challenge is to treat these otitis media to prevent the deafness. Also give the vitamin A because conjunctivitis is there, and later on there is a keratomalacia, and it lead to blindness. So the challenges of this measles infection, one is otitis media. So correct management of otitis media and prevent the deafness. Second, the correct management of these eye, there is a conjunctivitis and vitamin A, and reduce this later on, there is a blindness. And also the good nutrition during the measles infection and management, and it prevent the protein energy malnutrition.
Thank you so much, sir. Thank you for answering that question. We'll move to the next question, and the next question is related to the potential long-term complications. What are the potential long-term complications or sequel of measles infection, and how can they be monitored or managed?
So long-term, two main complication is there. Long-term nutritional complication, I already told there's a protein energy malnutrition. And second, there's a CNS complication. There is SSP, subacute sclerosing panencephalitis. And mostly it presented as there is the neurodegenerative disease of CNS in children. And mostly after at the 4 years after the infection of measles.
Thank you so much, sir. Thank you for answering that question. We'll move to the next question and the last question before we conclude. And the question is related to the management. How does the management of measles differ in special populations such as immunocompromised patients or pregnant women?
So in case of this management in compromised child, there is so there is a main it is a symptomatic management of this measles, but main thing is vitamin A. So vitamin, when there's a infant is there, give the 2 lakhs units of vitamin A 2 lakh international units, 1 lakh international units. And when the age is more than 1 year, give these 2 lakh international units vitamin A. So it prevents these later on blindness, and also the good management of nutrition. So it prevents these later on there is a protein energy malnutrition. So basic treatment there is a symptomatic. Also there is a temperature, give these to reduce temperature by tepid sponging and antibiotics. And when there is a infection, there is a pneumonia, the main respiratory complication, then give these antibiotics and vitamin A and oxygenation, and manage the pneumonia in children due to measles and bronchopneumonia also.
Thank you so much, sir. Thank you for answering that question and all the other questions. With this, we would like to conclude the session here for today, and I would like to thank all of our viewers for their ardent participation that they have shown by staying tuned with us. And I would like to thank you, sir, for taking out your valuable time and for being here at our platform